My name is Jackie Seth, and I'm the co-chair of the Physical and Mental Health Committee of the Columbia Alumni Chapter of Delta Sigma Theta Sorority Incorporated. And we're grateful to have you here for I think it's seventh annual Health Education and Alzheimer's Disease Talks, otherwise known as HEAD Talks. We'll be getting started momentarily. I wish I had some music to play for you. But if anybody wants to sing, last year we had a singer. If anybody wants to sing and come out, so I'm looking at I have a couple screens. I'm looking and some people are like, not it. But I feel like this could be your opportunity to be found, like, discovered, as they say. This is where the magic can happen. Just raise your hand and we're here for it. Okay, now. Okay, well then we'll go ahead and get started. So, good evening, everyone. Again, on behalf of the Columbia Alumni Chapter of Delta Sigma Theta Sorority Incorporated, in collaboration with Johns Hopkins Alzheimer's Disease Research Center and Curing Alzheimer's Now Dream Foundation, we welcome you to HEAD Talks 2025. Tonight's theme is Nourish the Mind, Brain Bowls, Breakthroughs, and Brain Health, particularly among Black people. And we're here to explore science, share stories, and spotlight new ways to get you engaged and protect your minds, families, and futures. And we invite you to join us in the chat. I'm going to show you how to use it. It's pretty easy to follow. I think people have been doing Zooms for a while, but just in case, you can use the buttons that are on the screen there for you as a little housekeeping. So if you have any questions, you can just raise your hand, share your emotions, and put them in the chat if you have questions. But we did run one quick poll because we wanted to see how people felt about the topic that we're discussing tonight. And so I want to see, Corinne, can you see the results? Corinne is helping me, I think, from the background. Corinne?
I can see the results. Yes, they're still coming in.
Still coming in? Good. Okay. Well, that's good. We're seeing how folks feel because we wanted to get an idea of what people are thinking and feeling about the topic. And we really wanted to get some engagement from you tonight. So don't hold back. To kick things off, and we've done this probably last year was our first year doing this, and this is our second time doing it. We're going to start with a quick memory exercise to get our minds engaged. And this only takes a few minutes. And so we're going to just go ahead and toss it over to Corinne, and she's going to start with a quick memory test, I would say. I think test makes people a little anxious. So I'm going to say game, memory game. Yes.
Yeah, absolutely. Let's go with memory game. So my name is Corinne Pettigrew. I'm with the Johns Hopkins Alzheimer's Disease Research Center. And I do research in brain aging and the earliest stages of Alzheimer's disease. And tonight I want to just kind of throw out an engaging activity. As Jackie said, we can think of it as a game. We're going to show you a list of 12 words here on the screen. You can see them. And what we want you to try to do is remember these without writing them down, because we're going to ask you to recall as many of them as possible later this evening. So I'll go ahead and read the words out now, though of course you can probably see them fine, but the words are balloon, tree, tricycle, needle, orange, river, cat, yellow, table, leaves, change, acorn. All
No
right.
pressure. No pressure.
Just try your best to remember as many as you can. And while I'm off mute, Jackie, you want me to share the poll results?
I would really love that. Thank you.
All right, here, I'll put them on the screen.
Oh, nice. So it looks like people really feel like sleep and rest nourish their minds the most. I would have to agree. If I didn't get to vote, but I would say sleep and rest. And I don't see trash TV on this list, so there's a problem because that's kind of my thing too, right? But it might not be nourishing, but it is my thing. So sleep and rest is what we're going to go with. Sleep and rest. That's it. Thank you. Thank you, Corinne, for that. Sleep and rest. Okay, let's get going on our next topic. So, I'd like to take a moment to introduce our first speaker, Dr. Nana Yaw Sarkoti. Dr. Adu Sarkoti is a clinical geriatrician and family medicine physician with expertise in medical care of older adults. His clinic interests include dementia care, caregiving, well-being, and he serves as a deputy director for geriatrics and extended care clinical center at the VA Medical Center, and currently is the medical director for PACE of West Baltimore. He brings to PACE his experience in home-based primary care, community living centers, as well as a physician experience and expertise in medical care for older adults. He is a phenomenal man and speaker. He has accolades and a master's degree in public health from Columbia University. He actually has a fellowship in geriatrics at Louisiana State Health Science Center in New Orleans. He's a member of Kappa Alpha Psi Fraternity Incorporated, so that's wonderful. Shout out to them. We're so happy to have him. And Dr. Adu Sakoti will help us to understand how metabolic treatments such as GLP-1 receptors, are showing promise in the brain health among Alzheimer's and prevention. And just have the whole conversation, because I think a lot of people are taking advantage of this now, and we just want to see how the impact is on our brain. So without further ado, Dr. Adu Sakoti.
Thank you for that introduction, Jackie. I felt a little embarrassed about that whole intro myself. So good evening, everyone. Thank you for this wonderful opportunity to kind of share some information with you all. I guess what we usually do with presentations is just kind of start off with just like laying some of the information, the ground rules a little bit, some background if you want, if you will. So we'll start talking about the growing concern of Alzheimer's. So we all know that the population of the world is actually aging more than usual, not more than usual, but it's just aging in general. And in America, the aging population, the number of people turning 65 and older is about 10,000 per day since 2011 and supposed to carry for 18 years after that. And given that there's an estimated 7.2 million Americans aged 65 and older who have been diagnosed or are living with Alzheimer's in 2025. Older Black Americans are about twice as likely to have Alzheimer's or other dementias as older whites, and older Hispanics are about 1.5 times as likely to have Alzheimer's or other dementias as older whites. And the kind of the graph or the picture next to it are the modifiable and non-modifiable risk factors for dementia and Alzheimer's in general. So again, age is number one risk factor for dementia. Your genetics can play a role. If there's a lot of dementia in your family, that could play a role as well. And then there's some of the things that we do to ourselves, like smoking, diet, lack of exercise, physical activity, etc. Hearing loss is one of the main ones that we often take for granted. So these are some things that we can kind of really impact in the future to kind of reduce our risk for Alzheimer's or just dementias in general. Now, what exactly is dementia? Dementia is, next slide. There we go. Dementia is an umbrella term for loss of memory and other thinking abilities that are severe enough to really impact your life. So primarily, everyone thinks about dementia primarily as a memory issue, but it's really the memory kind of linked to lack of being able to kind of take care of yourselves on a day-to-day basis. So things like ADLs or activities daily living that we talk about in a clinical setting. So bathing, dressing, toileting, hygiene care, etc. If your memory loss impacts those domains, then we kind of start thinking about dementia. And then under the umbrella term, there are different types of dementias, and we categorize them into Alzheimer's, vascular, Lewy body, frontotemporal, other things like Huntington's, Parkinson's disease. And there could be a kind of a mixture of some of these other terms too. So you could have a combination of vascular and Alzheimer's. People with Parkinson's may also have Lewy body or etc. Or Lewy body can mimic Parkinson's. So there's a vast kind of variety of different types of dementias that fall under this umbrella. Next slide, please. And as we kind of talk about this dementia term or even Alzheimer's, we want to kind of talk about what changes occur in your brain. So here's a schematic of a healthy brain versus an Alzheimer's disease brain. And the main pathological features are what's called amyloid plaques, neurofibrillary tangles, neuroinflammation, oxidative stress in the brain. So simply put, there are large changes within the brain structure itself. The brain kind of shrinks, gets full of a lot of fluid. There are, I want to call them scars. So the amyloid plaques kind of create areas in your brain where the normal processes don't work very well. And then a lot of the neurons also kind of get tangled up. That's what we call the neurofibrillary tangles. Now, the places where you kind of consolidate your memory, the hippocampus, those are areas where the brain kind of shrinks. So as you see from the top brain structure, you see a nice normal hippocampus, and then the one below it, you see that it's shrunken severely. So now you can't really even process the memory. So people with Alzheimer's have trouble maintaining short-term memory. So the things you've stored over a long course of your life will stay. So long-term memory stays. But me telling you what just happened about a few minutes ago with those 12 words that we're going to be tested on a little bit later, we may all have a little bit of trouble recalling those things. So typically, folks with Alzheimer's have a really hard time recalling things that they just learned or just retaining new knowledge. So because we're also talking about GLP-1s, we also talk about diabetes as well. So in 2021, about 38 million Americans, or 11.6% of the population, was diagnosed with diabetes. And the percentage of Americans age 65 and older remains high at 29.2%, living with diabetes. And then about annually, 1.2 million Americans are diagnosed with diabetes. And as the US sees a rise in diabetes rates, Black and Hispanic populations have the highest prevalence. So you can only imagine that we have the highest prevalence of Alzheimer's disease, of dementias, and also highest prevalence of diabetes also. Next slide. Now, why are we talking about these two things in tandem? So we recognize that there are vascular risks that can accelerate the progression of Alzheimer's disease and also vascular dementia. And these vascular kind of risk factors are compounded by hypertension and diabetes, right? So the damage to cerebral vascular system leading to vascular dementia, the vessels get shredded, they have increased risk of stroke, increased risk of hyperglycemia, especially in the brain structures, which can lead to neurofibrillary tangles and also amyloid plaques as well, which then ultimately lead into the cognitive impairment, which then ultimately leads into dementia. Next slide. And as we continue talking, studies have also shown that insulin resistance and aging are major risk factors for Alzheimer's disease. And you can see in this Venn diagram how the symptoms and the risk factors kind of overlap. So we talk about inflammation, oxidative stress, low vitamin C levels, impaired insulin signaling and insulin resistance especially is highlighted, and then glucose intolerance and cognitive deficits kind of intertwine between both diabetes and Alzheimer's. Next. Now, what exactly is GLP-1? We've been talking about that, or that's the focus of this evening's talk, at least for this presentation. So glucose-like peptide was discovered in the 1980s and is shown to stimulate insulin secretion. And a lot of the receptors are found or they're produced in the small bowel, in the colon, and also in the CNS or the brain. They have a very short half-life, and an enzyme called dipeptidyl peptidase is one of the enzymes that kind of cleaves it and clears it, and also clear through the renal system. So sometimes there is another diabetic medication that's a DPP-4 inhibitor called sitagliptin or Januvia, the brand name, that kind of helps extend the half-life of this enzyme or this product, excuse me. And you can know the GLP-1 agonist receptor agonists by their suffix "tide." So examples are exenatide, liraglutide, I can always mess up on these words, dulaglutide, and also semaglutide. And their trade names are Byetta, Saxenda, Trulicity, and Ozempic. Next slide. So why is this increased or this robust interest in GLP-1s? So research reported at the Alzheimer's Association International Conference 2024 suggested that liraglutide may protect the brains of people with Alzheimer's disease and reduce cognitive decline by at least 18%, so almost 20%, after 1 year of treatment compared to placebo. So this is exciting news because now we have some new kind of product that may actually mitigate the cognitive impairment from Alzheimer's disease. Another study looked at neurodegeneration and stroke after semaglutide and tirzepatide in patients with diabetes and obesity. Again, this cohort study, it showed that GLP-1 receptor agonists were associated with lower risk of dementia, stroke, and all-cause mortality in adults with type 2 diabetes and obesity. So they're primarily marketed or indicated for diabetes and also for obesity, or that's mostly what we've been using them for. But we're discovering that we can actually use them for Alzheimer's interventions as well. And they have the potential for neuroprotective effects in Alzheimer's disease, like I just mentioned, reducing inflammation, oxidative stresses. They are being explored as a potential therapeutic target for Alzheimer's disease. And primarily, they reduce amyloid plaques, have been shown to reduce amyloid plaques, enhance neuronal survival and plasticity, and also improve insulin sensitivity and glucose metabolism. Now, nothing in this world is cheap or free. So we want to just take a look at just some of the costs of these medications. And they range from about $800 per month to about $1,300 per month. And these are the names of the drugs, their active ingredient, the brand product name, their launch date, and also what they're indicated for by the FDA. So again, they're indicated for diabetes and also obesity management primarily. Now, with this new research that's come out, we're looking at how they can impact Alzheimer's and dementia in particular. Also want to talk a little bit about side effects. So again, we're talking a lot about how beneficial these drugs may be, but they also carry a lot of risks and some side effects also. And I highlighted here that it's essential to recognize that their use associated with certain intrinsic risks that must be not be disregarded. The incidence of adverse effects, particularly GI complications, are number one, or the most prevalent psychiatric disorders, including depression and suicidal ideation. And other problems such as sarcopenia. Sarcopenia is the loss of muscle tissue, muscle mass. You may also get ileus, which is a small bowel blockage, and also eye disorders, including retinopathy. There are a lot of new trials that are out there right now and future directions for these medications. So one I wanted to highlight here is the Evoke and Evoke Plus trial, looking at these medications and their impact on Alzheimer's disease. It's an ongoing trial right now, and the data hasn't been published or come out yet, but we're really excited to see what this trial will kind of lend in the future. I also highlighted a few other trials going on right now. Two of these highlighted here in red are on liraglutide, and they're also promising. And these studies were done in mice and rats. There's also advances in diagnostic testing, and I don't want to take too much from Dr. Mogakar's presentation, but I just wanted to highlight that the FDA had approved a blood test that we can use now to kind of diagnose Alzheimer's. And it's called Lumi Plus G P Tau 217 beta amyloid 142 plasma protein ratio. A mouthful nonetheless, but it is a blood test that we can use to kind of classify folks into high risk probability, low risk probability, and then the intermediate. And in those intermediate folks are the ones who may require more testing or further testing to really identify if they have issues with Alzheimer's. Next slide. There's also other treatments available for Alzheimer's disease. There's Leqembi and Aduhelm, which are both anti-amyloid therapies. They're monoclonal antibody therapies. They've been shown to have a 22 to 27% reduction in cognitive decline, and they're primarily used for folks with mild cognitive impairment. So it's not everyone who qualifies for this medication, but those who have mild cognitive impairment, they can be trialed on these medications. I'll go back really quickly. Right. I also want to kind of highlight the cost of these drugs also. And they range from about 27,000 euros to 34,000 euros for a 1 year supply. So again, these drugs are promising, but they do have high cost, and they also do carry some side effects as well. I wanted to include a slide on the usual treatments for Alzheimer's that we have right now, which include cholinesterase inhibitors like Aricept, and also Namenda, which is a neurotransmitter glutamate, excuse me, which helps boost attention, mood, and alertness in patients. And it is a combo drug as well. And then the next slide, we'll talk about lifestyle modifications. So I want to really kind of spend some time here. And oftentimes we're all looking for a magic bullet or a magic pill to kind of take our ills away, so to speak. But the things that we do currently right now in our youth or younger ages is what's really going to impact us as we get older. So half of dementias could be prevented by eliminating these 14 risk factors. And they include lack of education, hearing loss, high cholesterol, depression, traumatic brain injury, physical inactivity, diabetes, smoking, hypertension, obesity, excessive alcohol, social isolation, air pollution, and visual loss. If we spend time on just these lifestyle modifications here, we can potentially reduce the risk of Alzheimer's by 45%. So if you're not active, get active. If you smoke, try and quit. If you drink alcohol, reduce that. If you get poor sleep, get as much sleep as you can. If you have hearing impairments, speak to an audiologist, speak to your primary care doctor, see about getting hearing aids, reserve your hearing for as long as possible. That one kind of, really surprised me at the percentage in reduction of risk there, about 7%. Only because, again, if you think about just getting older or as being an older adult, if you can't hear your environment, you are more at risk for depression and also isolation. And then isolation is also carries a 5% risk as well. So just those two things are about 12% risk for Alzheimer's in the future. Next slide. Tips for improving brain health and reducing risk of cognitive decline and dementia. Again, we just really want to pursue a heart healthy lifestyle, including, again, I already mentioned this, but regular physical and mental activity, balanced diet, managing stress and health conditions like high blood pressure, diabetes, and hearing and vision loss. You want to get quality sleep, try not to smoke, limit alcohol, prevent head injuries. And then you want to really try and maintain strong social connections with family and friends. And I think talks like this, where we all kind of come together, congregate, share ideas, share thoughts, and share comments, are really helpful. If you're part of a fraternity, sorority, that's awesome also, because again, all the activities that we get to enjoy together are important. Again, maintaining your family and familial connections are also very important. In summary, Alzheimer's disease and diabetes share common underlying mechanisms. GLP-1 agents may offer potential therapeutic approach for Alzheimer's disease treatment, and they're promising. Again, further research is needed to fully explore the benefits and risks of this and other therapies. And I really want to kind of spend time and just highlight that lifestyle modifications remain an important part of prevention and management. We can't always pill or drug or chemical away issues. The hard thing that we can do is all the lifestyle things because they really require you to change your habits. Um, and oftentimes, those are things you are reticent to change, right? So I'm addicted to smoking. I can't quit. We can help you. There's patches, there's gums, there's hypnosis, there's behavioral health. There's a whole host of things, right? I don't like people. I wanted to stay by myself. Well, it's really important to kind of stay engaged at all times. I don't like reading books. Well, there's other activities that you can do. There's games, right? Gamification of things. So there's a whole host of lifestyle modifications that we can use to really try and prevent the and mitigate the risk of Alzheimer's. Now, I'm just going to take a little point of personal privilege. So PACE stands for Program of Program of All-Inclusive Care for the Elderly. And I belong to PACE of West Baltimore program. There are actually 4 programs in the state of Maryland. Elder Plus at Hopkins is the oldest program. Actually, stay on that last slide, Jackie. And the whole premise of PACE is that we're trying to be an all-inclusive center for old adult care. We operate a day center where adults can come to. We operate the clinic that the adults can also come to seek care, and we're also the insurance company. So we're really trying to ensure quality. And the main premise is that the patient and their caregiver are at the center, and they're surrounded by all these people who make part of the interdisciplinary team. And so we are all working 40 hours a week, 5 days a week. We're all here on staff every single day. We also have a therapy gym complete with, steps, exercise bikes, and all the exercise equipment. So again, if our older adults want to exercise, they have an opportunity to do so just by walking down the hall to our gym. Next slide. And as I was mentioning, and I want to give you all the information, there are 4 PACE sites here in Maryland: Hopkins, Elder Plus, West Baltimore, Trinity Health, and Senior Community Care in Hyattsville. And the eligibility criteria is really fairly simple. It's you have to be 55 or older. You have to live in one of the prescribed zip codes. For us in Baltimore, West Baltimore, that's prescribed by the state. Have to have 2 or more ADL needs. So again, difficulty bathing, dressing, hygiene care, etc. Be able to live safely in the community independently or with a caregiver, and also be Medicaid and Medicare eligible. And then I included a photo and the information for our outreach and enrollment manager, Ms. Carrie Frazier, and she works tirelessly to screen a lot of our potential referrals for inclusion to PACE program. And I believe that should be the last slide. Thank you for your time.
No.
Open to questions.
Okay, we do have a question in the chat. It says, do over-the-counter supplements like Prevagen work for memory? I feel like my brain has reached equilibrium sometimes.
Okay. Well, The short answer is no. But with all things, people feel that these supplements work. I always advise that if you are going to be taking supplements, please let your physician, your provider know that what you're doing so that they can also be a part of your care team in this endeavor. Sometimes supplements can interfere with your medications. So, for example, ginkgo biloba, if you're on ginkgo and also on warfarin, that can actually increase your risk of bleeding. So you just need to make sure you advise your provider, your primary care provider, that you're on some type of supplement, and also make sure you drink plenty of water. Yeah, I don't think that Prevagen has been really studied well, but a lot of people say that it does work for them. So there is that effect as well.
Okay, and we had another question. With all the promising data coming out in support of GLPs, is it recommended for everybody?
So it's recommended for those who have diabetes, and in some formulations recommended for those who are interested in weight loss. But the indication for Alzheimer's treatment at this time is not there. The data is promising. We're just waiting for that indication. Um, Now, if you happen to be on a GLP-1 and you're noticing some improve cognition, that's a whole other story. But I would recommend that, we all try and find some of these studies and enroll and be participants so we can get more data, especially in our community going forward.
Great questions. Let me see if I have any more in the chat or if anybody would like to raise a hand. It said, did I understand right that new tests are being developed to identify higher risk of dementia and Alzheimer's before it develops? If so, are there any efforts to ensure that those who are identified through such tests are protected from being penalized by their insurance companies? That's a really good question, if you know that.
That's a great question.
Yeah.
That's a great question, which I don't have a ready answer for right now. But I will definitely take that back and see.
Yeah, we can definitely email and when we send out our information after this, we can see what we can get for you because I like that question, Julio. Thank you so much for sharing that. The next question is it thought that GLP-1s help to prevent dementia, or is it just useful in treating if you have been diagnosed with dementia?
It's been shown that the GLP-1s can actually reduce the amount of amyloid plaque formation in the brain. They can also increase insulin sensitivity inside the brain as well, which then kind of affects the cognition and the development of Alzheimer's. So to your question specifically, we're looking at ways to see if it can actually prevent dementia in the those who are predisposed or have risk factors or have mild cognitive impairment already, but not necessarily for those who actively have late stage dementia.
Okay. All right, so I think Dr. Adusakoti is going to stick around. So if
Yes.
he has some questions, we just put a little engagement in the chat, and there was a survey asking had folks heard about this before this talk, and it seems like a lot of folks hadn't. It's like 71% of folks had not actually heard about this. So I think we're bringing really good news and information to people, which I think is really important. So
I think also people have probably heard of the drugs, but not necessarily knew what their class is. Because I think if you say Ozempic, everyone knows Ozempic, but and Wegovy, but they may not know that those are classified as or in the class of GLP-1s.
Yeah. And I think what I learned tonight is, you see all the commercials, but I hadn't understood if there was a connection to
Mhm.
brain health or impacts, and I appreciate you pointing some things out, but also giving us things to look at as far as research for ourselves and the impacts of that. So thank you so much, Dr. Dusakoti. If you have
You're
questions for him,
welcome.
feel free to put it in the chat. We're so grateful to have him stick around for a little while. We're going to move on because we have so much great information. It's like I'm trying to keep it all. And our next topic will be on blood biomarkers. Now, Dr. Adusakoti talked a little bit about this, but he didn't want to take away from Dr. Mogakar, who is an associate professor of neurology at Johns Hopkins University School of Medicine. In addition to his commitment to patient care, he's a the research director of the Center for Cerebral Spinal Fluid Disorders, as well as the core leader for biofluid biomarker care at Johns Hopkins Alzheimer's Disease Research Research Center, excuse me. His research included identifying biomarkers for neurodegenerative disorders, and we're so grateful to have him here tonight. He actually spoke at our Memory and Aging Community Advisory Board annual dinner last week, and it was really, I feel like it was last week, maybe it was 2 weeks ago, it was in October. Everything is running together, but we're so happy to have him here, and he's going to discuss incredible progress in detecting early signs of Alzheimer's through simple blood tests, which I found really interesting. So share more. The floor is yours, Dr. Mogakar.
Thanks so much, Jackie, for that generous introduction. And
yeah, your screen, you want to switch?
Yep.
Okay.
And Dr. Adu Sarkodi gave a really comprehensive yet succinct review of the management of Alzheimer's disease. I am going to dive deeper down into the diagnosis of the condition and how blood is being used now for making the diagnosis. But just to step back a bit, people use the term dementia and Alzheimer's disease interchangeably, but they are not the same. It's like people use migraines and headaches interchangeably. You know, all migraines are headaches, but migraines are not the only cause of headaches. They just happen to be the most common cause of headaches. And the same thing is with the relationship between dementia and Alzheimer's disease. Alzheimer's happens to be the most common cause of dementia, but there are other causes, as we just heard. When somebody comes to us in clinic with memory and cognitive complaints, they don't come in with a diagnosis of Alzheimer's disease, right? I mean, we do some testing, we figure out they're having problems in their daily life, they're having difficulty managing their finances or doing groceries or getting lost. We do some cognitive tests, we find out they're impaired. But then the important question becomes, what is the underlying cause of this impairment? Is it Alzheimer's disease that's causing this dementia? And for that, you need to do diagnostic tests, and that's where biomarkers come in. Now, you know, in Alzheimer's disease, as you heard, you know, there's multiple things that happen. It's not just one protein that's abnormal. You've got deposition of amyloid plaques outside of the brain cells. Tau tangles form inside of the brain cells. Those end up causing neurons to die. When neurons die, that's when it starts affecting your cognition. But in addition to amyloid plaques and tau tangles, Alzheimer's also is associated with leakage of the blood-brain barrier and neuroinflammation. And it's this neuroinflammation that most likely is the target of the GLP-1 agonist that we just heard. But what is a biomarker? You know, it's a fancy term, but biomarker just means something that can be measured in the body, which is that indicates whether you have an underlying disease or a biological condition. Now, not to get too fancy, but even blood pressure is a biomarker, because if your blood pressure is high, you have hypertension, and that increases your risk of developing coronary artery disease or stroke. So, you know, blood pressure is a biomarker. And similarly, there are biomarkers now for diagnosis of Alzheimer's disease. About 20 years ago, if somebody had dementia, the only way to be sure that somebody had underlying Alzheimer's disease as a cause of the dementia was to do an autopsy, get the brain, and then stain the brain for those amyloid plaques and tau tangles. But then 20 years ago, people developed specialized scans, PET scans, followed shortly thereafter by tests of cerebrospinal fluid. And these same proteins that get deposited in the brain can now be measured either on the PET scan or by measuring these proteins in the spinal fluid. Now, how do you obtain spinal fluid? You know, the spinal fluid is actually made inside the brain, and then it goes all the way to the base of your spine, and it can be safely taken out from the base of the spine over here by putting a needle in. So it's still an invasive procedure, and you can then collect the fluid. You can collect anywhere from 20 to 40 ml. You make about 500 ml in a day, so you're not taking out all of the spinal fluid. And now there are many companies that make FDA-approved spinal fluid tests. You know, they've been around for several years now, around 3 years. On the imaging side, you know, there are now different ligands or different markers that can bind to the amyloid, and you can visualize the amount of amyloid. As you can see here, In a normal brain, you do have some amount of amyloid in the white matter of the brain, but as people develop Alzheimer's disease, you see there's much more extensive amyloid deposition in the brain. All the red stuff is amyloid in the gray matter or the cortex of the brain. And there are 3 FDA ligands that are approved now. These are covered by Medicare, so CMS has approved these ligands. But even then, they remain expensive. But why are biomarkers important? So if you were to ask a clinician, without doing any of this specialized testing, clinicians would be wrong about nearly 1/3 of the time. And this rate of misdiagnosis just based on a clinical assessment is much higher in primary care. And if somebody's presenting with very mild symptoms, like in mild cognitive impairment, the rate of misdiagnosis is even higher. It's very difficult to say with confidence in somebody who has mild cognitive impairment that the underlying diagnosis is Alzheimer's disease without biomarker testing. So biomarkers are very important to make an accurate diagnosis, and that influences prognosis in turn. And they're not only important for clinical purposes, but also for research, because when you want to do clinical trials of disease-modifying agents, you want to make sure that the underlying dementia is due to Alzheimer's disease and not vascular dementia, because you don't want to pick the wrong population to try out your new medication. So as I mentioned, the CSF tests have been approved for 3 years, PET scans have been approved for even longer, but they both need specialized skills. PET scans need specialized centers. There are only a handful in Maryland. There's some radiation involved with PET scans. You really cannot scale up PET scans to do this at a population level. And the same thing, there are not enough neurologists or radiologists to do spinal taps to serve the entire population that's at risk for developing Alzheimer's disease. And they remain expensive. Despite insurance coverage, of an amyloid PET scan can cost anywhere from $500 to $1,000 in terms of your copay. And that's why doing blood tests is very important, because you can have your blood drawn anywhere at your local lab, in your physician's office, at a Quest or a LabCorp, you can go, and you can then scale it up at a population level. The problem with blood is that the proteins like amyloid and phosphorylated tau that are abnormal in Alzheimer's disease, those are present at very low concentrations in blood compared to, say, albumin, which is one of the most abundant proteins in blood. So essentially, it's like detecting 100 grains of sand in 17 metric tons of sand. So, that's the challenge why we haven't had blood biomarkers for a very long time now. But, the technology advances, and now there are several markers that can be measured in blood. There are amyloid markers, there are markers of tau, there are other markers like neurofilament light and GFAP that can also be measured. But we are going to focus mainly on p-tau217 and A-beta42 and 40. So even though the ratio of amyloid, A-beta42 and 40 is different between controls and Alzheimer's disease, the difference is very minimal. Whereas p-tau levels are much more different. They're nearly 3 to 6 times higher in people with Alzheimer's disease, and hence it's a better test. And multiple studies have now shown that p-tau217 measured in plasma, essentially blood, is comparable to that in spinal fluid and in tau PET scans. So initially there were a lot of tests that were available commercially, but the FDA has approved these 2 tests. So if you need a test, it's better to go with an FDA-approved test. Of the 2 tests, the Roche Plasma p-tau181 assay is approved in primary care. It's mainly a rule-out test, means if your p-tau181 test is normal, you can safely rule out that you have Alzheimer's disease. Whereas a more solid and confirmatory test is the Lumipulse p-tau217 to A-beta42 test. It's approved in specialty care, meaning somebody in a memory clinic, for example, or a neurology or a geriatric psychiatry clinic would need to do this test after doing a comprehensive analysis or assessment of your cognition. So these tests, these blood biomarkers, are only valid in patients with cognitive impairment. By this, I mean the more advanced Lumipulse p-tau217 to A-beta-42 test. The utility of these blood tests, all of us are anxious to know if we have Alzheimer's disease or not once we get into our 50s, right, or 60s. But these tests, we don't know how these tests function in people who don't have symptoms or any objective confirmation of memory problems, for example. So if your cognition is normal, you shouldn't be going out and getting this test done because we don't know how to interpret the test. Those trials are going on, and maybe in a year or two, we'll know how to interpret these tests, even in those who have normal cognition, whether it predicts future cognitive impairment or not. But as of today, these tests are approved only if you have confirmed objective cognitive impairment in a physician's office. And just one science slide, which is where they compared the blood biomarkers to PET scan results. So people who had a high blood biomarker level were also positive for the amyloid PET scan. People who had a low blood biomarker were negative for the amyloid PET scan. Though you can see there were some people who fall in this indeterminate range. So it's by no means a perfect test. So essentially, you get three results. If your ratio is high, it's positive, and that means there's a very high likelihood, like a 90% or higher likelihood that you have amyloid in your brain. If your ratio is below this threshold, then there's a greater than 90% probability you don't have amyloid in your brain. And about 20% of patients are going to fall in this indeterminate range where you are going to need further testing. So patients with mild cognitive impairment are the ones who are most likely to fall in this intermediate probability range. And in those patients, they are going to need confirmatory testing with either the PET scan or the CSF test. And most of these patients are going to need follow-up with a repeat assessment in a year or so to see if those levels have changed or not. But these tests are still not perfect. We don't have good information of how these biomarker levels perform in people with different racial and ethnic backgrounds. There's likely kidney function that affects the levels of these biomarkers. So in people with advanced kidney disease, for example, those on dialysis, we don't know how this test will function. People with poorly controlled diabetes or people who have significant obesity, we don't know how these biomarker tests will perform. And we need good markers of tau. We need other markers of tau. We need markers of neuroinflammation. We need markers of synaptic dysfunction. So there will be additional blood biomarkers that will be coming on the stage. So the main takeaway is that we can now make a reliable diagnosis of Alzheimer's disease using blood. It's going to be clearly more affordable and widely available compared to CSF or PET scans. But we do need to refine these biomarkers further to ensure that these tests work well across all the different groups, across people who have, again, many of the comorbidities like advanced renal disease or poorly controlled diabetes, for example, or high BMI. So stay tuned. Thank you.
Thank you, Dr. Mokakar. We do have a question in the chat. Is there a genetic test already developed for predisposition of Alzheimer's disease?
So people are working on that right now. These tests are currently not meant to serve that role. But it's very likely some combination of an amyloid tau marker and a synaptic marker will then be available in the near future that will, in fact, predict your likelihood of progression to cognitive impairment due to Alzheimer's or not. But we are not there yet, but it's an area of active research.
Okay, thank you. Another question. What kind of other studies of research can we get involved in?
So Corinne would be the best person to guide you about this. She heads our outreach core. The Hopkins Alzheimer's Disease Research Center is doing many studies, and depending on what stage you're in, how impaired or not you are, even cognitively normal people can enroll in many of the studies that are ongoing at the ADRC, and we need participants.
That brings up a good point. I just joined a study this year, And I was for years telling Black people all over, especially in the world of memory loss and dementia, to get involved in research. But I honestly was a little scared to do it myself because I didn't want to be poked and prodded and things like that. But this was my first year that I was like, I'm going to do it. And one of the reasons it was a little self-serving because I trust Corinne, but also I was able to get a MRI and a PET scan, and you just mentioned how expensive they are, and they can do this for me for free, and they were obligated to give me the results for this. And I felt really good about it after that. And there wasn't a poking and prodding. I was able to actually, I did the cerebral fluid test, and I was nervous, but they walked me right through it. It was painless, and I was surprised. And it was the BioCard. It was a BioCard research program, and this was my first year. And then they paid me. It was such a great experience. But that wasn't why I did it. But it was really good. So I think if Corinne, you want to share a little bit about that in the chat. I mean, anyone, if you'd like to know more, she is the expert to ask about that. But I just wanted to make a plug for research because this was the first year I decided to sort of walk the walk that I was talking, and I have not regretted it one bit. And I don't have to ingest anything, which is very good. So that was good. But another question we have is, can you share more on why it's important for these approved blood tests to only be used in people with cognitive impairment? Why can't we use them in individuals who are worried about future memory loss? That's a good question. Thank you.
Because these tests are not quite ready for that prime time yet. The number of people who are going to fall in the intermediate range will be much higher. And then you'll be unnecessarily subjecting these people to spinal fluid testing or PET scans. So we don't know how this test performs in people who have normal cognition. But again, I think these studies are being done right now all over the US as well as internationally. And we will have those results in the coming year.
That's another important part, being able to get the results, because I think a lot of times in certain communities, we can feel like we're being tested on and not shared with the results.
Right.
So
I think that's very important.
Yeah. Okay. We have another opportunity for you to get engaged in the conversation, and we're asking, would you consider getting a blood-based biomarker test to detect early Alzheimer's? So if you want to go ahead and give your response in the poll, we would appreciate your feedback. And in the interim, we'd like to thank you, Dr. Mogakar, for being here today and sharing this important information. Hopefully you can stick around and you can answer any questions that anyone may have in the chat for you because it's great information. And we are going to be sharing these slides because we have given out a lot of great information tonight. We do like to provide individuals with the resources that we discussed this evening. And so we'll put together all of that and send it out to you guys so that you can share it along with the recording for this. So thank you again. Okay, now we're going to shift a little bit to what I would consider probably the heart of the evening. And we're going to talk to Dr. Miller. And I want to just introduce him, even though he doesn't want me to. He doesn't want me to, but I am going to. He is armed with a PhD from Morgan State University Department of Social Work. And Dr. Miller's unparalleled expertise focuses on Black fatherhood, men's health, rites of passage programming for adolescent Black men and youth, designing customized mentoring experiences for Black men and boys. His work, which has significantly impacted the field, includes over 16 years of a consultant at the federal level, and he's responsible for fatherhood, writing policy briefings, designing toolkits, professionals in the field, engaging with them, hosting webinars, coming to topics like this. He really does a lot of exciting, significant work that challenges him. And he has had challenges in his life, being a caregiver for his brother and his father. Both becoming ancestors a few years ago. This personal experience has deeply informed him of his professional work and underscores his unwavering commitment to understanding and supporting the unique challenges faced by Black men. And Dr. Miller's articles on Black fathers appears in several social work journals and other periodicals, solidifying his position as a leading authority in this field. And he is going to share his journey as a caregiver and what it meant to support a loved one with memory loss. And we're so grateful to have him here. And so, Dr. Miller, I know you didn't want me to do that, but I had to let everybody know. We have you, and it's our pleasure. So the floor is yours, Dr. Miller.
So thank you. First and foremost, I want to thank Delta Sigma Theta, Johns Hopkins School of Medicine, and any of the folks who may be behind the scenes pulling together this amazing conversation as both of the content experts were sharing. Even though I know you guys are going to send out the handouts, I'm just jotting down notes because I'm actually going to be doing a qualitative study among Black men who are caregivers because we just don't know a lot about Black men who are caregivers. I want to start off by saying I became a caregiver at 9 years of age. My brother and myself taking care of my mother. Grew up in West Baltimore. My mother was diagnosed with multiple sclerosis. She ended up leaving the Baltimore City Public Schools. She was a high school teacher. She loved her job. She was diagnosed with multiple sclerosis, and she ended up, it became so debilitating that she had to take a leave from her teaching position. My dad worked for the post office. He worked 6 days a week. So my brother and myself were left up to being my mom's primary caregiver. I was 9, maybe 10. My brother was 12 or 13 years old. And it wasn't, ladies and gentlemen, until recently that I realized that my caregiving journey started as a little boy. It was in conversations with my therapist that I began to realize that my caregiving journey started much earlier. Before I talk a little bit about my dad, I want you guys to write this name down, Randy Gillard. Randy Gillard he served 8 years on the city council in Hampton, Virginia. He was caring for his 80-year-old mother. He ended up killing his mother and taking his own life. This happened in June of this year. He ended up killing his mom and taking his own life because the arduous process of not only being a caregiver, but Randy also started to experience his own set of medical challenges. And as a result, he felt like the situation was so dire and so hopeless that he killed his mom and he killed himself. I share that with you because, ladies and gentlemen, I would submit that being a caregiver, while there are many highs and there are many lows, there are many folks that I've spoken to in the caregiver community who are at that stage where they're thinking about committing suicide because of the lack of medical support that they receive, and most importantly, the lack of family support. Oftentimes, it's only left up to one sibling to be the caregiver. In my situation, my brother died. My brother was 55 years old. He was taking care of my dad at first. My brother, we found out that my brother had cancer. He wasn't going to the doctor. By the time we were able to get him to the doctor, he was stage 3, and he died shortly after that diagnosis. And so I was entrusted in terms of taking care of or taking care of not only my brother's final wishes, but also becoming the primary caregiver of my father. While it has probably been one of the greatest experiences of my life, it was very difficult. I had 2 children in college, a wife, had a family. I was traveling a lot internationally, doing projects in West Africa and in South Africa. So I had to literally cut my entire schedule in half to be home with my dad. Luckily, I was able to reach out to some national organizations that have a database of caregivers, and I was able to find 2 caregivers, one who literally came to my house, 3 days a week, and then I was able to find a caregiver who would come occasionally on weekends because I still had to travel. I still had some commitments to handle. But one of the things that I think is often not discussed, particularly in the Black community, is this awesome caregiving tradition. And that there's so many folks that we may know that are caregivers who don't even say anything. I find that a lot of I found that men in my network who knew that I was a caregiver, I found out by accident that they were caring for their mom or for their dad or for one of their grandparents. And I think that one of the things that we all can do is strengthen community education around autism, around dementia, around the role of caregivers, because I think that there are just so many men and women who are suffering in silence. Again, I was fortunate because I did have some family support, but I was able to identify some committed caregivers. Many folks that I've talked to in the caregiving community have had absolute horror stories trying to find caregivers who will come in, change mom or dad, feed mom or dad, and do some of the other things, medication management, some of the other things that are really, really important. I really believe that I was fortunate. My dad passed away last July. I was with him when he passed away. He passed away at home in my home. So I'm eternally grateful for the experience. And it has also led me to, I'm actually going to be writing a children's book. One of the things that I do is one of my passion projects. I write children's books, but I'm going to write a children's book about how dementia can impact a family because I don't think it's talked about enough. And it's something that affects millions and millions of families. And so I will turn it back over to Miss Jacqueline in case there are any questions.
Thank you, Dr. Miller. I appreciate that. It is a very personal and powerful message. I think you're absolutely right. Can Dream Foundation just published our book about the experience with my grandmother and how that impacted us. And you're right, there's not a lot of people talking about it, especially with little brown faces like ours to talk to a younger demographic. So we really appreciate you sharing that. So I'm going to encourage everybody to have a moment of reflection at this point. Because we really would like to allow you to put some questions in the chat. And there seems to be one for you, Dr. Miller. It says, how did you navigate that season? Because you talked about the mental aspect, did you have any support groups, things like that you leaned on, faith? What were you doing?
So faith, therapists on speed dial. I know a lot of times Black men don't like talking about therapy, but I talk about therapy all the time. So, and then I'm a fisherman. So I fish all year round, and being able to have a caregiver be home with my dad, even if it was overnight, and I might go up to the Jersey Shore or on the Eastern Shore or down in South Carolina. So fishing has been a lifesaver to me. And then I'm an avid reader.
That's good. Thank you. We talk about mental health a lot as far as the Physical Mental Health Committee. We do a lot of reinforcement for that. So I'm very grateful that you brought up having a therapist, also having your faith, and how those two things are not mutually exclusive. You can have both and still be healthy in that aspect. So thank you for sharing that. We had another question that we want to talk about it. It seems there aren't often stories about men as caregivers. What made you decide to be so vulnerable and share yours?
I think it's critically important. And because the lion's share of my work is with Black men, I felt that it was critically important that we have these conversations and that we produce, products and things that people can use to drive community education. Because I think a lot of times what I have found is that men isolate themselves. So I do some work with a local group called the Binti Circle. A good friend of mine, Donita Brown, started a caregiving circle for Black women. And so as a part of that, I've done some webinars with men, and we find that a lot of the men are caregivers but are suffering in silence. And so if I can be an advocate, if I can be a source to get men to really begin to talk about what's going on and to join support groups and support networks, then I'm all for it.
Oh, thank you for that. And someone asked, is there a platform for men that you would recommend? It sounds like you're on the path of going to start one, which is great. And I'd also recommend the Binti Circle for women. We had a conversation about them, I think, last year at this talk. But if people could get something that you may have used or a platform that you currently maybe could recommend for men.
We're building it with the Binti Circle, so it'll probably launch February or March of next year.
Okay. Thank you. And we also had some reflection from a participant about watching his grandmother transition with Alzheimer's and the effect of that. So I think I really appreciate you being so vulnerable to share that as well in the chat. So thank you for sharing that. We do appreciate that. So we've given out, like you said, a lot of information tonight, and we don't want to end it just there. We have an opportunity for a little bit more reflection. We're going to have one more sort of opportunity engagement. It's your turn to put it in the chat, or you can use the poll. We're going to ask you a quick question. What one food, habit, or mindset will you commit to nourishing your brain? I want to see what folks are going to say. You can write in the chat. You can put it in the short answer on the poll. But, we've learned about a lot of things tonight, and I want all of us to take a moment to reflect and commit to something. Will you stop smoking if you're a smoker? Will you have a couple of less cocktails a week? Or will you get to moving your body? Or will you start eating a little more vegetables, as my kids call it, instead of vegetables around here? So what are you going to do? I think that we're encouraging you to take some action today. And while you're doing that, I want to share that we will be giving out a lot of resources. As I mentioned, we'd like to do that after this. It's going to have information about diet, health screening. It'll have the link to this transmission, some of other information. So you're going to be able to have access to that after this by coming to this event. And so we hope that you share that information that you get very, very broadly, because, we know some folks wanted to join and maybe weren't able to. So we want you to maybe get the word out. So as you're still thinking about what you'd like to share, I want to give a second to go back to Corinne, because we remember some words earlier. Do y'all remember those words? No pressure.
Yeah, see, I'm a little worried that people won't actually like me after this event and after giving these words lists.
They're gonna like you, Corinne. What's not to like? So now, am I supposed to share the words now, or are we gonna
Not
try?
yet.
Okay.
All right. I know I'm looking at on my other screen at the poll. People are still responding to the poll. About 60% have responded so far. But for those of you maybe who have already responded, I want you to think back to the list of words I presented earlier and take a minute to remember as many as possible. You can either try to put them in your head, think of them in your head, or jot them down if you have a piece of paper handy. And I'll pause for about a minute to let you get as many of those words as possible.
Now, Corinne, how many words were there?
There were 12.
There were 12.
There were
Okay.
12.
Let me see.
An increase from last year's 10.
I know, because I was thinking last year wasn't that many.
I mean, it's only 2 more words, right?
It's a lot.
It is a lot. It's meant to
Like
be.
20%. Okay. All right. I'm gonna write. Let me focus.
You can hum the Jeopardy song while you're at it.
Well, I'm gonna go over the answers. We're gonna go over the answers to the mindset, and we're gonna end the poll if that's okay with you. And we're going to see some folks' answers, because I want to know what they're saying. So can we see that? Oh, can you see it, or can I see it?
Can you see the answers? I can see the question.
You know what's funny is I can see it. It's really awesome, but I got to figure out how I'm going to share it. But I will say this. It's a beautiful tapestry of words. And one of the big words was sleep, water, eating properly, daily exercise, which was really good, and trying, I see try, which I love, to move intentionally. So I'm gonna actually add this beautiful word cloud, because this is so pretty. I'm gonna figure out a way to do that, because I don't know how, but I'm going to do this. And then I'm going to share it with everybody, because it made a beautiful tapestry. So I'm very grateful for you guys doing that. Thank you so much.
All right, well, now that you've sufficiently distracted everyone from writing down words, why don't you show the words that we talked about earlier, if you wouldn't mind?
I can. Okay, here we go. Everybody ready? Like drum roll kind of thing. Okay.
All right, so can you go, all right, so this is the list of words slightly rearranged. I'd be curious to hear if anyone wants to share how many words they remembered. If not, that's totally fine. 11 out of 12. Goodness gracious. You may have noticed that Some of these words, so we kind of rearranged them here, came from the same category because they were related to fall seasonal changes. Oftentimes noticing things like this helps us use strategy to remember items, including in everyday life. So a caveat, of course, that this activity is in no way designed to be diagnostic of any memory changes or concerns or memory loss, but instead our goal is just to provide an example of something you might do, for example, when you're having your memory assessed by a doctor in a clinical setting or in a research study. So list learning tasks such as this, assess someone's ability to remember my items over time. So sometimes you're given a list of words and there's some distracting activity in between and they're asked to recall them again. Though typically it isn't, 30 minutes of super engaging presentations. So that, that the situation is a little bit different.
Yeah.
Again, just a fun activity to get your brain moving and provide an example of a memory test, which we hope you find interesting.
I agree with that. And for my research, I did some of this, and it was interesting because I got really anxious in that, not like I didn't remember 11, Dr. Mahdi. It was not giving 11. So that was really great. I'm very proud of you. But I think is what I learned is that you cannot, beat yourself up. It's not indicative of everything. And so I appreciate this. But yes, so thank you for giving us this opportunity, Corinne. It's always a pleasure every year because it makes me test myself. I did not get 11 again. But shout out to you, Dr. Mahdi. I'm about to give you a prize of some sort. I don't know what it's going to look like, but we're going to talk about that. Okay, so what you may not know is that November is actually Alzheimer's Awareness Month, okay? And as we close out the month, well, it's beginning of the month, but as we go through this month, we want to encourage people to begin to be aware of the signs and symptoms of Alzheimer's disease because early detection matters. We've learned a lot today. We want you to take practical steps to reduce your risk of developing the disease and live a healthier, longer life by improving your diet, exercising, meditating. There are so many different things that you can do to have a brain healthy lifestyle. And if you haven't already, you can check out the Johns Hopkins Alzheimer's Disease Research Center website for resources about Alzheimer's disease. You can learn about the actual studies that are going on. A lot of them are out there that are great. We need individuals to sign up. It's a lot of great information. And so take time to do that. I want to thank all of our presenters this evening, Dr. Miller, Dr. Mogakar, Dr. Adu-Sakoti. I really do appreciate all of you sharing today. We are going to be sharing information after this event. As I mentioned several times, you can get the replay, and we're going to have sort of a digital go back for everybody who signed up today. But what we really need from you in order to get that, because there's always an ask. There's an ask. We want you to tell us what you think. There's a QR code right there on the screen. If you could give a moment, it's about two minutes, if not even that. Just tell us about what you thought about tonight, if it gave you what you were looking for, and it helps us to improve as we move along and do more of these TED Talks every year in the month of November. So on behalf of the Physical and Mental Health Committee of the Columbia Alumni Chapter of Delta Sigma Theta Sorority Incorporated, Johns Hopkins Alzheimer's Disease Research Center, and Curing Alzheimer's Now Dream Foundation, we want to thank you for joining us today for our Head Talks 2025, and we hope to see you again next year. Have a wonderful evening, everyone.